My name is Donald Walker, and I'm going to be doing video journaling on my clinical experience in relation to some of the question or direction being posted by the professor, in relation to the learning objective in this class, and how well I'm able to review the syllabus and consider that to be relative to my present clinical rotation or my role as a caregiver in the future. I think syllabus is very important. It's kind of give you the ballpark or package about this class or what it entails. And a syllabus, when you look at it, it's like a roadmap to a destination. I know for a fact that this is the last class before the FMP graduation. Knowing or reviewing the syllabus, it will help me to understand what is expected of me on a weekly basis, and it will have a cumulative effect of success rates before the end of the class or at the end of the class before graduation. So when you look at that in terms of learning all the assignment that has to be done on a weekly basis, knowing what the grade and what will constitute to the success of your grade, and the breakdown as the assignment breakdown, it allows the student to be prepared ahead. On a weekly basis, it means we are being judged or assessed by the professor based on our ability to be able to execute the assignment well, either collaboratively or individually. So it's very important, and that will also help me as a future care provider. I need to understand the reason why my patient comes to the clinic. They come with a complaint of headache or abdominal pain. I should be able to ask clearly, or I should be able to understand based on the symptoms being presented, so that I'll be able to know what kind of objective and subjective data to collect before I can talk about the review of the system and all that. And also what kind of diagnosis I'm going to formulate before I can cross to the interventional treatment plan. And also talking about the review of assignment description, I think it's very important because I will not know what the right question to ask my professor if I don't review, the assignment, because reviewing the assignment would help me to understand what the assignment is describing, what the assignment is saying that I should do. So in order for me to establish, clarity, if I'm confused about it, I think it should be clear to me that the only person I can ask is my professor, who is more knowledgeable, about what it entails that I should do. So I think that's very important. Also, if I carry that as a future care provider, I need to review, why my patient came to the clinic or to the hospital, depending on where I'm going to be working at. That's why we have review of system. That's why we do the SOAP notes. When you do the review of system, then you narrow it down to the reason why patient came to the hospital. I think it's very, very important, aspect of the learning and understanding, our assignment, whether we carry that by understanding our patient, and then we know the right way to treat them. The overall goal in this course is to pass, of course. Before I graduate, any student will want to pass. Nobody wants to fail. But you have to really understand the aspect of what is needed to be done before you can pass. So it's not just about passing, it's about me. I know I'm going to be a nurse practitioner in the future, but I need to know what my role entails. What do I need to do, as a care provider? So once I understand my role, I know everything that needs to be done, and that will help me, when I'm dealing with my patient, when they come with different and various complaints, health concern and all that. So it's not just about passing. Of course, I want to pass. I have to pass in order to graduate, but also about learning. And what are my experiences and expertise to bring? I work primarily in the ER, and I have the opportunity to crisscross to different units like ICU, mental health, detox, tele, and message. So in relation to discussing or engaging my classmates in any discussion, I think I'll bring all those useful experiences that I have in terms of, dealing with different patients of all kinds. ER is the gateway to the hospital, and almost 99.5% of the patients that have been admitted in the hospital come through ER. So I know a kind of patient that goes to ICU, and I know the reason why they go to ICU, because they have a critical problem, chronic or whatever it is that they have to deal with. So that's why if any discussion like that comes up, it will be easier for me to tap into those experiences and those skill and all those experience. I can use them to discuss with my classmates. Thank you.